Homework assignment number one. Homework assignment number one. The first decade of life, we have reproduction. During reproduction, there's an increased oxygen level in the lungs that causes a decrease in the blood flow resistance to the lungs. The lungs inflate and begin working on their own, moving oxygen into the bloodstream and removing carbon dioxide by breathing out. Next, we have infancy. The infant body will grow more rapidly than at any other time in birth during the first 2 years. By 2 years of age, the infant would be more than 70% greater than he was at birth. These height and weight gains occur in little growth spurts. An average child will grow 2.5 inches in height and weigh gain 5 to 7 pounds a year. However, the rate at which the height and weight increases decreases with each additional year, and it depends on the gender. Now we have toddler and preschoolers. Around the age of 3 is when toddlers begin to lose their belly fat and develop leaner, more athletic bodies. The abdominal muscles form, tightening the appearance of the stomach. Healthy toddlers may grow an additional 2 to 3 inches and gain from 4 to 6 pounds each year. Now we have young children, ages 6 to 10. As children get older, baby teeth start to fall out and are filled by permanent teeth. Children usually start losing their baby teeth from around the age of 6. From the age of 6 to 12 years old, children have a mixture of adult and baby teeth. The baby molars are replaced around 12 years of age. At around 7 to 8 is when some girls begin to show the first outward signs of puberty, the developing of breast buds and body hair. This is on the early side of normal. The average age is about 9 to 10, but doctors have been increasingly seeing signs of puberty before the age of 7 in many girls. Most boys don't show visible puberty changes until 9 to 10, or about 2 years after an average of girls. The second decade of life is the adolescence. This is a transitional phase of growth and development from childhood into being an adult, commonly equated with puberty. During this phase, our bodies grow stronger and are filled with hormones that create a desire to copulate. Male and females both begin to notice bodily changes such as acne, growth spurts, body hair production, and hormonal changes, changes of the voice, shape, and the body. In this stage, male reproductive organs begin to grow and function, creating reproductive cells. Males also begin to produce testosterone at this time. For women, this is usually when they achieve their growth spurt, and it's usually followed up by the menstrual cycle. The third and fourth decade of life is early adulthood. At this point, physical maturation is now complete. Our height and weight may increase or decrease slightly. In early adulthood, our physical abilities are at their peak. This includes our strength, reaction time, sensory, and cardiac functions. Around our 30s is when things start to make a change within our bodies. For most people, our eyes start to stiffen and thicken, creating minor problems with vision. Sensitivity to sound decreases, and the rate of hearing loss is faster in men than in women. Hair begins to thin and change around the age of 35, although it can happen earlier or later. Also, our mid 30s, our skin begins to dry and wrinkle, and wrinkles begin to appear on the skin. The immune system starts to weaken around our mid 30s as well. During the fourth and fifth decade of life, mid adulthood, ages 40 to 59 years old. Most people between the ages of 40 and 60 will need some form of corrected lenses for vision deficits. Hearing also further declines in this stage. The skin continues to dry out and is prone to more wrinkling, mostly in the facial area. Age spots and blood vessels become more apparent as the skin continues to dry and get thinner. Around this age is when women go through various hormonal changes leading to menopause which is the end of the menstrual cycle. The sixth decade of life and up, late seniors, adulthood, until death. This is when we see the most physical decline. Cells begin to inflame and decay. Muscle mass decreases drastically by this point. The immune system is no longer capable of functioning as strong as it used to when you were young. Bodily organs become less strong and less responsive, and our heart and lungs become less efficient. For men, aging changes in the male reproductive system may include changes in testicular tissue, sperm production, and erectile dysfunction. The tubes that carry sperm may become less elastic. In 50% of men, their prostate glands expand and it's replaced with scar-like tissue. For women, loss of bone density speeds up after menopause because less estrogen is being produced. The ovaries will stop making hormones and estrogen, and they will also start releasing eggs.